What if a medication you were told would protect your health is quietly weakening your heart instead, especially as you get older? What if the very drug meant to keep you safe is slowly interfering with the heart's natural rhythm, energy, and resilience? And most importantly, what can you do about it starting today? Stay with me, because in this video I'm going to expose a serious problem affecting millions of older adults, and I'll guide you toward the solution that most people are never told about. Let's begin with the uncomfortable truth. As we age, our hearts do not respond to stress, chemicals, and medications the same way they did at 30 or 40. The aging heart becomes more sensitive, more vulnerable to electrical disturbances, nutrient depletion, and metabolic strain. Yet, despite this reality, one class of commonly prescribed drugs is handed out almost automatically to older adults, often without a serious discussion of long-term consequences. Many people take it for years, sometimes decades, believing it's harmless or even essential, but from a cardiac perspective, this drug can quietly sabotage the heart's ability to function at its best. This medication interferes with the heart's energy system. Your heart is not just a pump, it is the most energy-demanding muscle in your body. Every single beat requires a massive amount of cellular fuel, primarily generated inside tiny structures called mitochondria. These mitochondria depend on specific nutrients and biochemical pathways to keep your heart beating strong and steady. The drug I'm talking about disrupts those pathways. Over time, the heart muscle becomes less efficient, more fatigued, and more prone to weakness. Now here's where things get even more concerning for older adults. This drug doesn't just affect energy production, it also interferes with key nutrients that protect the heart. Nutrients like CoQ10, magnesium, and certain fat-soluble vitamins are critical for maintaining proper heart rhythm, preventing muscle damage, and supporting healthy blood vessels. When these nutrients are depleted, the risk of arrhythmias, heart muscle stiffness, and even heart failure increases. Many seniors experiencing unexplained fatigue, muscle weakness, shortness of breath, or irregular heartbeats are never told that their medication could be contributing to these symptoms. Another major issue is inflammation. Aging already increases low-grade inflammation in the body, and chronic inflammation is one of the strongest drivers of heart disease. This drug can worsen inflammatory pathways, making blood vessels less flexible and more prone to damage. When blood vessels lose their elasticity, the heart must work harder to push blood through the body. Over time, this extra strain accelerates cardiovascular aging. The heart thickens, stiffens, and becomes less adaptable to stress. What makes this situation especially dangerous is that the damage happens slowly. There's no dramatic warning sign at first, no sudden pain that makes you question the medication. Instead, it shows up as subtle declines, less stamina, slower recovery after exertion, mild dizziness, or a feeling that your body just doesn't bounce back the way it used to. These changes are often dismissed as normal aging, when in reality they may be medication-induced. Even more alarming is how this drug affects cholesterol metabolism inside the heart itself. Cholesterol is not the enemy it's often made out to be. In fact, it is essential for cell membrane integrity, hormone production, and even proper nerve signaling. The heart muscle relies on balanced cholesterol levels to maintain structural strength and electrical stability. When cholesterol synthesis is aggressively suppressed, heart cells can become fragile and dysfunctional. In older adults whose regenerative capacity is already reduced, this becomes a serious problem. Now let's talk about the nervous system's role in all of this. Your heart is controlled by a delicate balance between the sympathetic and parasympathetic nervous systems. This balance determines your heart rate, rhythm, and response to stress. Certain medications disrupt this balance, making the heart either overstimulated or sluggish. In seniors, this can lead to palpitations, sudden drops in blood pressure, or an increased risk of falls, all of which are often blamed on age instead of the real underlying cause. The most frustrating part? Many older adults are never given a full explanation. They're told the drug is necessary, that it's standard, that the benefits outweigh the risks. But rarely are they informed about nutrient depletion, mitochondrial damage, or long-term cardiac stress. Rarely are they told there may be safer alternatives or supportive strategies to protect the heart while addressing the original health concern. This is not about fear, it's about awareness. When you understand what's really happening inside your body, you regain control. You stop being a passive patient and start becoming an informed decision-maker. And that's where the solution begins. Because here's the good news, damage is not inevitable. The heart has an incredible ability to recover when given the right environment. There are ways to protect your heart, restore depleted nutrients, and reduce unnecessary stress on your cardiovascular system without ignoring your overall health needs. The key is knowing what to support, what to question, and how to work with your body instead of against it. Let's go deeper because this is where everything becomes very clear. The drug cardiac specialists are increasingly worried about, especially for older adults, is the long-term use of statin medications. Now, this may surprise you because statins are often presented as almost untouchable, as if questioning them is dangerous. But real heart health is not about blind trust. It's about understanding physiology. Statins work by blocking a key enzyme in the liver responsible for cholesterol production. On the surface, that sounds logical. Lower cholesterol, lower heart risk. At least that's the story most people hear. But cholesterol production is not an isolated process. That same biochemical pathway is also responsible for producing CoQ10, one of the most critical molecules for heart energy. When statins suppress cholesterol synthesis, they also suppress CoQ10 production. This is not optional biology. It happens every time in every person to varying degrees. For a younger body, this depletion may be partially compensated for. But in older adults, the heart already produces less CoQ10 naturally. So now you have a double hit: age-related decline plus medication-induced depletion. The result is a heart that struggles to generate energy efficiently. This is why many seniors on statins report persistent fatigue, weakness, and reduced exercise tolerance. The heart simply doesn't have the fuel it needs to perform, but it doesn't stop there. CoQ10 is also essential for protecting heart cells from oxidative damage. Without enough of it, free radicals accumulate inside heart tissue, damaging cell membranes and mitochondria. Over time, this contributes to heart muscle degeneration. This is one of the reasons we see a higher incidence of cardiomyopathy and heart failure symptoms in long-term statin users who are older. Another major issue is muscle damage. The heart is a muscle, and statins are well known to cause muscle pain and weakness in skeletal muscles. What's not discussed enough is that the same process can affect cardiac muscle. When muscle cells are deprived of energy and exposed to oxidative stress, they become inflamed and dysfunctional. In severe cases, this can alter the heart's electrical system, increasing the risk of arrhythmias. Now let's talk about magnesium. Magnesium is absolutely critical for heart rhythm stability. It helps regulate calcium movement in and out of heart cells, which directly controls contraction and relaxation. Statins have been shown to interfere with magnesium balance, either directly or indirectly through increased urinary loss. In older adults, magnesium deficiency is already common due to reduced absorption and medication interactions. Combine that with statins, and you have a setup for irregular heartbeats, palpitations, and even atrial fibrillation. Then there's vitamin K2, another overlooked factor. Vitamin K2 plays a vital role in directing calcium to the bones and away from the arteries. When K2 levels are low, calcium can accumulate in the arterial walls, leading to stiffness and calcification. Some statins interfere with fat-soluble vitamin metabolism, including vitamin K2. This means that while cholesterol levels may appear lower on paper, arterial health may actually be worsening. Stiff arteries force the heart to work harder, accelerating cardiac aging. One of the most misunderstood aspects of statins is their effect on inflammation. While they may reduce certain inflammatory markers in the blood, they can increase oxidative stress at the cellular level. This creates a false sense of security. Blood tests may look better, but the heart tissue itself may be under increasing stress. In older adults whose repair mechanisms are slower, this imbalance becomes especially dangerous. Now pay close attention to this next part, because it explains why so many people are confused. Doctors often rely heavily on cholesterol numbers, particularly LDL. But LDL is not a single substance. It comes in different particle sizes. Large, fluffy LDL particles are far less dangerous than small, dense LDL particles. Statins lower total LDL, but they do not always improve particle quality. In some cases, they may even worsen insulin resistance, which increases the production of small, dense LDL, the type most associated with arterial damage. Insulin resistance is another critical piece of the puzzle. As we age, blood sugar regulation becomes more fragile. Statins have been linked to increased blood sugar levels and a higher risk of type 2 diabetes, especially in older adults. Elevated blood sugar damages blood vessels and nerves, further stressing the heart. So now you have a situation where a drug prescribed to protect the heart may be indirectly increasing one of the strongest risk factors for heart disease. What's even more concerning is how symptoms are handled. When an older adult on statins experiences memory issues, muscle weakness or fatigue, these symptoms are often labelled as normal aging. But cholesterol is essential for brain function, nerve insulation, and hormone production. Suppressing it too aggressively can affect cognition and mood, which in turn impacts heart health through stress hormones and nervous system imbalance. At this point, many people feel trapped. They think, if I stop the medication, my heart is at risk. If I continue, my body feels worse. But this is a false dilemma. The real solution is not blind continuation or sudden stopping. The real solution is understanding how to protect the heart while addressing cardiovascular risk in a smarter, more supportive way. Because here's the key truth. Heart disease is not caused by cholesterol alone. It is driven by inflammation, insulin resistance, nutrient deficiencies, oxidative stress, and poor mitochondrial health. When you address those root causes, the heart begins to heal and strengthen. Now let's bring everything together, because this is where empowerment replaces fear. If you or someone you care about is older and taking this medication, the goal is not panic, and it's not rebellion against medical advice. The goal is strategic protection of the heart, working with the body's design instead of suppressing it. The first step is restoring what the heart has been quietly losing. When a medication interferes with energy production, the solution begins with supporting the heart's energy system. The heart thrives on efficient fuel, stable blood sugar, and robust mitochondrial function. This means prioritizing nutrients that directly support cardiac energy. CoQ10 is one of the most critical. It supports ATP production, protects heart muscle from oxidative damage, and improves overall endurance of the heart. For older adults especially, replenishing this nutrient can make a noticeable difference in stamina, clarity, and heart rhythm stability. Magnesium is another cornerstone. Without adequate magnesium, the heart becomes electrically unstable. Palpitations, skipped beats, and tension in the chest can emerge even when tests appear normal. Supporting magnesium levels helps the heart relax properly between beats, improves blood vessel flexibility, and lowers unnecessary stress on the cardiovascular system. Many older adults are deficient without knowing it, and medications only worsen this imbalance. Then there's the issue of inflammation and blood sugar. This is where true heart protection begins. Chronic inflammation damages the lining of blood vessels, while unstable blood sugar stiffens arteries and accelerates aging of the heart. The most powerful way to address both is not through more medication, but through metabolic support. Reducing refined carbohydrates and sugars, prioritizing whole foods, and ensuring adequate, healthy fats can dramatically lower insulin resistance. When blood sugar stabilizes, the heart experiences less oxidative stress, and L and DL particles shift toward a less dangerous form. Healthy fats deserve special attention. The heart is not afraid of fat, it depends on it. Omega-3 fatty acids support anti-inflammatory pathways, stabilize heart rhythm, and improve the flexibility of blood vessels. They also help counterbalance some of the inflammatory effects associated with long-term medication use. When the heart has access to the right fats, it becomes more resilient and less prone to dysfunction. Another overlooked factor is vitamin K2. This nutrient acts like a traffic controller for calcium, ensuring it goes into bones instead of arteries. Supporting K2 helps prevent arterial calcification, which directly reduces the workload on the heart. Flexible arteries mean lower pressure, better circulation, and a heart that doesn't have to fight against stiffness every second of the day. Now let's talk about movement. Not extreme exercise, but intelligent movement. The aging heart responds best to consistent, moderate activity that enhances circulation without overwhelming the system. Walking, light resistance training, and gentle interval-style movement improve mitochondrial function and insulin sensitivity. This type of activity tells the heart, you are needed, but you are safe. Over time, this strengthens cardiac output without excessive strain. Sleep and stress management are just as important. Poor sleep increases cortisol, raises blood sugar, and inflames blood vessels. Chronic stress keeps the heart locked in a fight-or-flight state, accelerating wear and tear. Supporting deep, restorative sleep and activating the parasympathetic nervous system through breathing, prayer, meditation, or quiet evening routines can dramatically reduce cardiac stress, especially in older adults. Perhaps the most important step of all is communication. This is where many people hesitate, but it's essential. Have an informed conversation with your healthcare provider. Ask about nutrient depletion. Ask about CoQ10, magnesium, and vitamin K2. Ask whether your cholesterol numbers reflect particle size and inflammation markers, not just total LDL. Ask if your cardiovascular risk could be addressed by improving metabolic health rather than increasing dosage. These are not radical questions, they are responsible ones. In some cases, medication may still be appropriate, but when it is used, it should be supported, monitored, and personalized. The heart is not a laboratory number. It is a living, adaptive organ that responds to nourishment, movement, and balance. When you give it what it needs, it often responds faster than expected. Here's what I want you to remember. Aging does not mean inevitable heart decline. Many of the changes we blame on age are actually signals of imbalance. When you correct the imbalance, the heart can regain strength, rhythm, and resilience. You are not fragile. Your heart is not weak by default. It is often just under-supported. Awareness is the turning point. When you understand how certain drugs affect the aging heart, you can take proactive steps to protect yourself or the people you love. You move from fear to clarity, from confusion to confidence. And that is how true heart health is built, quietly, intelligently, and from the inside out.